If you are a man between the age of 18 and 45 years, you probably think diabetes is an old age problem. But here is what worries me. I see men who look fine, some even look fit, but their sugar levels are already high. Not because they don't care, but because in our heads, being sick looks weak, and most men are trained to keep going even when the body is sending some signals. I am Dr. Sudhir, and this is the pattern I see regularly. A 32-year-old who skips breakfast, runs on coffee, eats late night, and sits sedentarily almost 10 hours a day. A 28-year-old man who works out 4 days a week but lives on delivery food and weekend alcohol binges. A 40-year-old with a small belly that keeps growing, but the weighing machine shows almost the same weight. They say, I don't eat sweets, I am not overweight, I walk regularly, and they delay testing until a health scare forces it. The real reason is simple. Testing feels like opening a door which you cannot close. So you postpone and the diabetes grows slowly. And here is one idea I want to share. In Indian men, diabetes risk is often about what's happening around your waist and inside your body, not just your body weight. In Indian men, fat doesn't show up as overall weight. It quietly collects around your belly and the internal organs, the fat which you cannot see or pinch from outside. Think of it like packing 2 suitcases for a family trip. Both weigh exactly the same. In the first suitcase, everything is organized. Clothes are folded in compartments, shoes in separate bags. You can close it easily and there is no pressure on the zippers. Whereas in the second suitcase, everything is stuffed in the center, bunched up. Pressing hard against the sides, the zippers strain and the suitcase bulges. Your body works exactly in the same way. When you are younger, your body packs fat neatly under your skin, in your hips and thighs, like that organized suitcase. You can see it, you can pinch it. That fat is relatively safer. But with age, stress and modern lifestyle routines such as 10-hour desk jobs, late dinners, poor sleep, your body starts packing fat differently, stuffing that fat deep inside around your liver, your pancreas and the intestines, like that of second suitcase. Everything is pressed in the middle, straining your internal vital organs. This deep belly fat, also known as visceral fat, which you cannot see from outside, also you cannot pinch it, but it's always there, and it releases chemicals that block insulin, forcing your pancreas to work harder and harder until it gets exhausted. At the same time, this modern sedentary lifestyle, such as less walking, more sitting, lesser sleep, makes you lose muscle. Let me tell you one key thing. Muscles are one of the main places your body uses sugars after meals. When belly fat rises and the muscle mass drops, sugar control suffers even if you don't look unhealthy. That is where the weighing scale misleads you. Your waist size matters more than your weight. If you are relating to this is not about shame. This is about catching a quiet problem early, while it's still simple to manage. In India, we see diabetes occur at younger age because of long desk hours, late dinners, sleep deficit, high stress, easy access to ultra-processed food. Early detection is not a bad news. It is your advantage. So here is when you should act. If your waist size is increasing, if you feel sleepy after meals, or you are unusually tired, if you are peeing more at night, otherwise if cuts are healing slowly, you have to consult a doctor. Start your journey with Practo and consult an expert diabetologist. Here is what happens at the consultation. First, the doctor will ask about your family history. If your parents have had diabetes, your risk jumps from 40 to 70%. The doctor will also ask about your sleeping patterns. Less than 6 hours of sleep doubles the risk of insulin resistance. Also, the doctor might inquire about your diet, eating patterns, alcohol consumption, and smoking. Along with this, the doctor will also measure your waist size. If it is above 90 centimeters, there will be 3 to 4 times higher risk of diabetes, regardless of your weight. The doctor will also check your blood pressure and look for the signs of insulin resistance. Then the doctor may order some blood tests. The main test is HbA1c. It shows your average sugar levels over the last 3 months. A fasting sugar is just a one-day snapshot, whereas HbA1c shows the bigger picture. They will also consider doing fasting and post-meal sugar levels together because many Indian men have normal fasting levels but high post-meal sugars. That's where early diabetes is hiding. Your doctor may also check for cholesterol and triglyceride levels. High sugar plus high cholesterol doubles your risk of heart disease. So what do the HbA1c test results mean? If it is below 5.7%, you are normal, but retest every 1 to 2 years if you have risk factors. If your HbA1c is between 5.7 and 6.4%, it is called as pre-diabetes and it is your warning window. Remember, here the diabetes is still reversible. Now, you might be wondering what reverses it? Losing 5 to 7% of your body weight, regular physical activities such as walking for about 150 minutes a week, having a good sleep hygiene involving 6 to 8 hours every day, and completely avoiding late night eating. And the good news is 40 to 70% of pre-diabetics can prevent diabetes with these lifestyle changes. If your HbA1c is more than 6.5%, that means you are having diabetes. But remember, this is not a death sentence. It is just a chronic condition which you can manage appropriately. The doctor will prescribe medications as well as some lifestyle changes. The key goal here is to keep HbA1c levels under 7% to prevent diabetes-related complications. Why control matters? Uncontrolled diabetes damages small vessels in your eyes, kidneys, nerves, and heart. It might lead to vision loss, numbness, erectile issues, even heart attacks. With good diabetes control, life stays normal. The real question is not, do I have diabetes? Rather, it is, am I controlling my diabetes well? If you recognize any of these patterns, consult a diabetologist on Practo now for screening and to get a clear plan. We keep sharing actionable advices on major health topics on this channel. So please subscribe and hit the bell icon.